Okay, let's get going. So thank you everyone for joining us this evening. We are tonight talking with Renee McGregor. We are very excited to have you, Renee. You're a real expert within your area, so it felt right to have you about this conversation. This is a series of Hertility talks, so we will kind of both get involved throughout the webinar, and then we'll do a Q&A at the end. So there's a chat box, so feel free to ask questions throughout. Like I said, it is recorded as well, so we will upload it to our YouTube channel at some point. So tonight we're going to be talking about eating for exercise and how to fuel your body for fitness and fertility goals. So I'll just introduce myself quickly. So my name's Emily. I'm a registered nurse and registered nutritionist. I work for Hertility Health. I am also a fertility advisor for Hertility. I have a background in working in gynecological and surgical settings within the NHS and private healthcare, and I've also worked within an NHS fertility clinic. I've got a master's degree in clinical nutrition and public health from UCL, and I hold consultations at Hertility as a fertility advisor to discuss hormone results with people after they've taken the fertility test, and also nutrition consultations. I mainly see people for fertility and kind of preconception health, pregnancy, and PCOS. So I'll just hand over to you, Renee, if you wouldn't mind introducing yourself.
Sure, I'm Renee McGregor. I'm a sports dietitian and author. I have worked in the field of dietetics for over 20 years, and I started my career in the NHS working across multiple different specialities, but kind of ending up in adolescent eating disorders. And from there on, I did further qualifications in applied sports nutrition, and since 2010 have basically been working in the sort of world of sport across, again, many different sports. I've been to the Paralympics in 2016 in Rio, and I'm the nutrition lead for both English and Scottish National Ballet. My area of expertise, I guess, well, the thing I'm best known for is working in REDS, which is relative energy deficiency in sport, and we'll probably be discussing that this evening, so I won't say any more than that now.
Thank you, Renee. Yeah, very impressive bio. Thank you so much. And then just a little bit about Hertility. So we offer end-to-end care from testing, diagnostics to treatment. So we have a at-home Hertility kit. So it's a finger prick test where you send off your bloods, get your results back. And we have a tailored hormone panel, depending on what information you put into the virtual health assessment. We have lots of different clinical services, whether it be online gynecologists, nutritionists, dietitians, fertility advisors, counselors, and then we also have different treatment options, whether it's referrals to our ultrasound clinic or fertility clinic partners. So whether it's for egg freezing, ovulation induction, IVF, or IUI. So that's Hertility in a nutshell. And in terms of nutrition consultations, you can book in with us. Like I mentioned before, I specialize in PCOS, pregnancy, and fertility, but we do have a team of registered nutritionists and dietitians. And this is our area of expertise down here. So we also see people for menopause, nutrition, reproductive health conditions, so things like endometriosis, postpartum nutrition. So, Renee, we're just going to start off with managing wellness trends. I don't know how you feel about this, but in the last year, it's definitely always been like this on social media, but in the last year, I feel like things have gotten really out of control. There is, rightfully so, there's a call out culture now because there is so much misinformation online when it comes to nutrition, and people who are not adequately trained within nutrition spreading pseudoscience and misinformation in this area, which can be really damaging, not only to the most vulnerable people, those with eating disorders, but people that just perhaps follow their favorite influencer, hear them saying this, and just because they've got a large following, kind of believe what they're saying, and it can be really detrimental and harmful. And I guess it does, feed into what we're talking about today, but even just thinking about fertility specifically as well, and kind of my area, I have a lot of people that come to me that have been told, go gluten free for fertility purposes, or for PCOS, and cut out fruit, and it's just it's just endless, the stuff that you hear people coming to you with. But and to clarify, with going gluten-free for fertility, there isn't any evidence for that, just to dispel that one, unless you have celiac disease or undiagnosed celiac disease, which we do know can affect fertility just because of the malabsorption of nutrients. But yeah, just wondering your thoughts on this, because I know that this is an interesting area for you as well. I'm sure you've probably got something to say on this.
Yeah, I mean, I think it's, as we've just said, it's very, very problematic. And I think there are a lot of celebrities, there are a lot of influencers, there are a lot of people talking about N=1 to their own experience. And I think that is also problematic. But I do feel sorry for the public as well, because I think it's very, very difficult to identify who is qualified and who's not. Because I think even in our field of nutrition, as the term nutritionist is not protected. So although you are, you're a registered nutritionist, which is really important, that registered bit's really key. There are a lot of people that call themselves nutritionists who are not registered because it's a title. So again, you on paper, you're looking at someone and they appear to have the right qualification, and yet they don't. And my big bugbear, and maybe it's because I'm a little bit older and I'd like to say a bit wiser, but I think also it's really important to have had some experience working in the field that you're actually talking about. So I think about that, I mean, like actually hands-on experience, like, we've both had experience working in the NHS, which means you're working with people. And I think that's very, very different to kind of absorbing theory and then regurgitating that theory in lovely, creative, beautiful reels and posts that kind of lock people in, but it's not nutrition and is not evidence-based and is not helpful. And I guess one of my key concerns is that the term health has really been skewed in recent years, with people assuming that health is very much like a physical aesthetic, health is kind of a particular way of eating, and health is kind of like around the amount of exercise you do. And again, we both know that it's none of those things, right? Health is all encompassing, but health has also got a very big component of well-being, and our well-being is so closely attached to our social connection. And if we don't eat, or if we have lots of rules around food, then that affects our social connection, which then affects our well-being. So I think health in itself is so complicated. And one of the kind of biggest challenges I see in the work that I do and the people I work with is lots of individuals trying to keep their bodies in places that are not appropriate for them. So genetically, they are pushing against their natural form, shall we say. And that means in certain situations that their fertility and their hormonal health becomes impacted and affected. And I guess that's kind of what we're going to unpick a little bit today as well this evening.
Yeah, thank you. Yeah, so do you want to go ahead with...
I guess it follows on is that, again, especially bearing in mind, I will generally work in a population of people that are physically very active. And I work across, I want to say from everyday runners and people that go to the gym all the way through to your professional and elite levels. So I think the reason why I want to bring this message up is that, we do know that public health messaging is constantly promoting this kind of fear around obesity, and I'm not saying we shouldn't be worried about it, but I just think it's created this narrative of move more, eat less, to the point where people have taken it to an extreme. And the issue I see is so many people, particularly women that come to my clinic, particularly with hormonal issues is that they have lost sight of how much energy and how much fuel in particular they need, not just for their training, but also for their biological health. And this is where it becomes complicated. So I think, you know, we have this problem. And then if you actually look at physiological studies, we know that the human body is actually biologically biased to achieve energy balance. And so it likes to be in energy balance. So actually, if you start exercising, or you start exercising more, or you suddenly have a goal, whether you're going to, like, you know, train for a marathon or whatever it might be, and suddenly your volume of movement goes up, then it's not move more, eat less. It's actually move more, eat more, because that's how you ensure that your body gets enough energy for your biological health, so your hormonal health, your digestive health, you know, your brain health, your cardiovascular health, but it also has enough energy not just to do the movement, but all the recovery and adaptation that also needs to go alongside it, which I think is where people get lost quite often.
Yeah, and I think it, like, going back to like the wellness trends and stuff like that, I think it's where things like intermittent fasting and stuff, which is, you know, become quite popular, can be detrimental in this area as well, particularly when thinking about things like fertility, but hormone health in general. But I do get a lot of people specifically asking me about intermittent fasting as well, and do I recommend it? So I wondered your thoughts on that actually. But I think, like, definitely from my standpoint, just because the kind of stress that it is putting on the body, and also just when people are skipping a whole meal as well. So I guess, like, you're coming at it from like a kind of fueling yourself appropriately angle, but from my perspective as well, just thinking about like missing or removing one whole meal from your daily diet, which adds up over time, you're missing such a huge opportunity to get lots of nutrients in there that you might otherwise not manage throughout the day, just thinking of like antioxidants and stuff for fertility. So you're, you know, missing out on that opportunity to try and get enough micronutrients in throughout the day. And then, yeah, there's also just not fueling yourself appropriately, and which can be really detrimental for women and and their hormones.
Yeah, I mean, I definitely don't recommend intermittent fasting to anyone, particularly not to women, because our reproductive system is more sensitive than males. And although, you know, our male peers will eventually end up with the same negative consequences of intermittent fasting, as females, we're going to see the signs and the consequences a lot quicker because of the fact that our bodies have been designed to reproduce. So as soon as they experience threat, then they start to shut down fundamentally. You know, so it's like, this is not a situation where a pregnancy can be maintained, so we're just not going to allow pregnancy to happen, is the kind of general consensus. So, and I think there's so many layers to intermittent fasting, in the sense of, it's not, like you said, it's not just about the overall fuel. It's about, you know, like, our hormonal health likes regular intakes of nutrition throughout the day, and particularly likes carbohydrates. So we know that that's something that we need to be including. But also, generally speaking, our cortisol, which is our stress hormone, tends to be higher in the morning. And if we end up doing a lot of training fasted, especially if you do high intensity training, or overall in your day you're not eating enough, you know, day after day after day after day, or because you're trying to get up early to do your training, you're not getting enough sleep, like, all of these areas of our life also add a layer of stress. And so fundamentally, if there's chronic stress in the system, the body is going to be monitoring that, and it is going to kind of send a message to the hypothalamus to say there's way too much stress in this body. So again, let's down regulate everything, which then affects our fertility and our hormonal health. And that in itself has so many consequences, as we're going to go on to discuss.
Yeah, thank you for that, Renee. Yeah, we'll delve into that a little bit more. Yeah, so I guess, like, it is all about energy balance, as we'll see. And obviously, yeah, you're a true expert in this area, but yeah, like you said, we need to be making sure that we're appropriately fueled prior to exercise, but it's also about the recovery as well, and matching our input to our output, which I think can be difficult as well for general population if you're not, seeing a sports dietitian or a sports nutritionist. So do you have any like tips for like the average person who's not able to go to see a specialist, in terms of like, fueling prior and refueling?
So I think the first thing to remember is, as I said, the human body is biologically biased towards energy balance. So what we'll find is if you increase your exercise output, you'll probably notice that your appetite will increase alongside. And that's not a bad thing. That's a good thing. That's your body telling you something.
Yeah.
And I do think, again, going back to sort of wellness trends and social media in general, I think we have lost sight of listening to our internal cues.
Completely. Yeah.
So I think we've become obsessed with our phones, our sport tech, like everyone's got some way of measuring something, whether it's your sleep, whether it's your HRV, and I'm not saying that they're not useful, they can be useful 100%, but they can also be overload. And I still don't think they should take you away from how you're truly feeling, right? And I always say that when I'm working with my athletes, we do look at things like HRV, which is your heart rate variability, which can be really interesting as data. But if an athlete is saying to me, I don't feel great, but my HRV is fine, I'm going to tell my athlete to listen to, I don't feel great, not my HRV is fine, right? But I will say with HRV, the longer you track it, generally speaking, the more in tune it is. Like there've been a few occasions this year when I've been working with professional athletes and they've had a really bad race. And then when I've gone back to them and said, what was your HRV doing before the race? And they're like, yeah, it was really low. And I'm like, well, why didn't you say something? Right? Because that's an indicator that perhaps your body was already, under some level of stress, whether that was an illness, like poor recovery or illness or whatever, it's kind of picking up on that. So, but I think we have lost sight of those internal cues. So I think if your appetite is increasing, it's kind of an indicator that, okay, my body needs more.
Yeah.
And when
we're worried of that a lot of the time, but
exactly. It's a good sign.
Yeah.
And types of food, I mean, again, we're living in this crazy era at the moment where, once again, and I feel really sad about this, but once again, carbohydrates are getting a real bashing, and yet they're so good for us. They're so important. And particularly when you're exercising, but I actually want to say for everybody. We're not just talking about people who are exercising, like people who are exercising may need more.
Yeah.
Everybody needs carbohydrates, especially women, because we've seen there are really clear studies that have shown the link between carbohydrate intake and production of a particular hormone T3, which if that is low, then again, that sends a sign to the hypothalamus and suggests there's not enough energy in the body, and that again shuts things down. So we know that carbohydrate availability and carbohydrate intake is important for every female, but is particularly important around training. So, if you are someone who is, I'm going to say runner just because it's kind of what I am and it's what I work with quite a lot, is, it is important to try and have some sort of fuel before you go for your morning run. Now, a lot of people will say to me, oh, but it's too early, I can't face food at that time of the morning. It's okay. You don't need to eat a massive bowl of porridge. That's not what I'm talking about. Like just having a glass of juice, just having a banana, just having a slice of malt loaf, having a handful of dried fruit, or 2 or 3 oat cakes. Like it doesn't have to be like something really heavy, but it just needs to be something that you've got a bit of carbohydrate in your system, which will help bring that cortisol down. You're going to feel much better in your run. And then when you come back from your run, you need to basically make sure that you recover properly. And so that definitely does need to be a bit more of a balanced meal of carbs and protein. So, that could be your porridge made with milk and then added Greek yogurt and fruit and nuts, or it could be eggs on toast, or it could be, I don't know, bagel with banana and peanut butter, like a proper balanced meal. If again, you're in a rush, which I know a lot of people are, then try and make sure you have a recovery drink that will give you carbs and protein. So that might be that you make up your own kind of smoothie, you know, it's like blitzed and it's ready to go. So as soon as you get in from your run, you have your shower, you grab it and you go to work. Like that's still better than a complete avoidance. I'm not saying it's what I would recommend, but it's better than complete avoidance. So the key thing is making sure that you are fueling well with carbohydrate. But the other thing regarding that is it's not just about carbohydrate in the snack or meal before you move. It's throughout the day. Like that's the thing, it's getting that right. And yes, protein is also important, and particularly as we get older, as we get, you know, and women who are going through perimenopause and then kind of menopause, we know our protein requirements go up. You know, the present recommendations are sort of 2 to 2.4 grams per kilogram of body weight across the day. Whereas for younger women, it's slightly lower. But again, it will depend on your training load. You know, people who are doing more may need slightly more protein, and people who are not doing quite as much can have a little bit less. So it's important that we get the balance right. And that doesn't mean avoiding fats and vegetables as well. Like they're all included. But I think what I want to get really clear is the carbohydrate availability is so key. And it's a thing that most women forget.
Yeah, for sure. And I think same with fertility as well. And particularly thinking about PCOS as well. I quite often have people coming to me that have been told to go very low carb. And I think sometimes it's difficult for people to know if they just get told low carb by the GP, they don't know exactly what that means as well. And in terms of like, you know, thinking of nutrients that are in carbohydrates as well, and thinking about fertility, they're so important. You know, we've got iron and B vitamins, and they're so important for fertility. So we don't want to be excluding those from the diet. There's lots of research in terms of carbohydrates, you know, particularly thinking about whole grain varieties when it comes to fertility. So important. We don't want to cut anything out. We just want to be focusing what we can add in, is what I always say. So yeah, this is what you've just mentioned here.
So we're talking about, I think here, like the key thing here, just this sort of definition is what is energy availability? Because I think in general nutrition, we often talk about energy requirements, whereas in sports nutrition, we tend to talk about energy availability. Now they're kind of linked, but energy availability is basically the energy that's available once all the energy that has been needed for movement has been taken out. So, and movement's everything. Like movement is, you know, not just your run, it's also if you're walking to the bus stop, or if you're walking up and down stairs all day at work, or whatever. So again, what I find is actually when I get women who are nurses, for example, and they're runners, often their energy requirements are so high because they're on their feet all day long, and they just don't appreciate it. And often they're often like compromised by the amount of time they have. But these women that actually their fertility is quite affected by the fact they don't realize it's not just energy for the run, it's energy for everything that's really important. So energy availability is what we work with in sport, because if there's not enough energy availability as a starting point, then that means biological function can't happen, and that's where it becomes problematic.
Yeah, thanks, Renee. So yeah, in terms of like the importance of hormones, then obviously you know, we've briefly touched on reproductive system, but we know that they affect so many different bodily functions. So yeah, do you want to elaborate on some of these? I know we've got another slide going into that, but what we're going to talk about in a second.
Yeah, so I mean, I think again, I always sort of kind of go back to when we're first introduced to hormones, probably like age 11 or 12 at school, when we're told about periods and we're told about, you know, having babies and those things. And it's quite terrifying, isn't it? Like the information we get told is that we're going to have this monthly bleed, and it's going to be painful, it's going to be inconvenient, and fundamentally it's really annoying. And so you sort of sit there going, oh my God, like, I don't know if I want this. And what we don't know is just how important it is for our health, right? So having a monthly menstrual period or menstrual cycle, whatever you want to call it, it's a barometer of health. It's telling you that your body has got enough energy to cope with everything that you're asking it to cope with, which I think is really important. But also, yeah. But I think what's really key is when your body is working, so that sign that we have that, okay, we're having a period every month, it means that you've also got enough energy in there to cope with to produce all the hormonal network that is necessary. And hormones are not just estrogen and testosterone, which I think sometimes that's what we believe. Like hormones are, like we've talked about, thyroid hormones, stress hormones, there's appetite hormones, there's hunger hormones, there's growth hormone. Like these are so important. And growth hormone in particular is really important for performance. So again, what I find when I'm talking to women is they don't realize that if you don't have a menstrual cycle, for whatever reason, then you're not producing hormones and you're not producing estrogen, and that means you're definitely not producing growth hormones. So what can happen is it will start to have a negative impact on your performance, and you might have an increased risk of injury. And again, estrogen is a really, really powerful hormone, which again, all we ever hear about is periods and babies, but actually it's important for our bone health. So that's critical if you're someone who's physically very active, but actually for all women, because we know that after the age of 30, our bone density starts to decrease. And then once you get into the perimenopause and menopause, when your estrogen levels are starting to decline, you can have a real significant reduction in your bone health, which is why that increase in osteoporosis and bone stress injuries goes up through the roof as you get older. Estrogen is really important for our mood because again, it's involved in the production of serotonin, and so it helps us to uptake serotonin, which is again important for an important neurotransmitter. And it's also key in terms of that actual adaptation to our training. So what I find interesting is that when I am working with women who are a little bit stuck and they've presented with hypothalamic amenorrhea, so not having a period, for example, in our clinic, they don't appreciate that the behaviors, particularly around exercise and maybe not eating enough, are complete. Like it's almost futile to be exercising because you're not going to get the results you're expecting. They always say, oh, but I'll lose fitness. Well, actually, no, you won't lose fitness because you're not gaining any fitness when your body's in that position. So hormones are really key, particularly in exercise, but obviously throughout our life and for many different processes.
Thanks, Renee.
Yeah, and I think when we go into sort of low energy availability, I mean, so when we talked earlier about what energy availability was, so that energy that's available, when that energy is not available, it's known as low energy availability. So again, the human body will always prioritize energy for movement. So it will keep giving the body the energy it needs to move because that's how we've evolved. And over time, if there's not enough energy left over, then it's called low energy availability. And fundamentally, it affects every single biological process in our body, from our immune health to our bone health, to our digestive health, to our psychological health, to our cardiac output, like you name it, it gets affected. Now, that's not to say that if you're in low energy availability, you will have every single symptom, but I think it's important to highlight that there are a lot of symptoms and you can get more than one or two. I've had some women recently, I've had a couple of triathletes who have presented with low energy availability, and they've had more than just loss of menstruation. They've had loss of menstruation, they've had multiple injuries, and they've started to have some like really severe cardiac issues as well. So I think it's really important to say that losing your menstrual cycle is often one of the first signs of low energy availability, but it's not the only sign, and it might not happen. You could have other things going on first, and still be in low energy availability. So I think it's important to highlight that. I don't know if you want to add anything to that.
I'm just going to ask you a question on that. Do you think that, is it usually at that point when your clients lose their period, that's the point when they usually come to you, because they've only realized then, because they don't recognize any of the other symptoms.
I'll be honest, majority of women that come to me actually come to me several months down the line after they've lost their menstrual cycle because they're starting to get injured.
Right.
And
Okay.
it starts to affect their performance.
Yeah.
Come to me. So it's almost like, okay, my period's gone, even though we know, and there's so many of us saying it's so important, it's so important, it's so important. A lot of women are like, I still think there are, even this year, I've had a handful of athletes turn around to me and say, but I don't feel like I'm working hard enough if I'm having a period. So that mentality in sport is
Mhm.
still there,
Yeah.
even though so many athletes are coming forward and talking about how important it is to have a period and the negative consequences of not having one. But there's still that sort of stigma around you're not fit enough, you're not disciplined enough, you're not working hard enough if you have a period. So yeah, I think again, and I think this is the bit that gets a bit complicated, is that when you're in low energy availability, you probably don't get many symptoms immediately. If
Yeah.
anything, you might actually feel great for about the first 2 to 3 months, and you might even have some amazing results from a performance point of view. But then it stops and it's no longer sustainable, because the further down the chain you go, like the longer and longer and longer you down, you've down regulated and depressed your hormonal health,
Yeah.
the worse it gets from a performance point of view, and the more it starts to affect you physically. So, I've had some really extreme cases in the years that I've worked, and I think some of the saddest cases have been women who I think have just left it so long that they've had quite irreversible problems. And
Yeah.
I think like irreversible problems to their pelvic floor, irreversible problems to their gut, because of like 95% of functional gut problems are associated with low energy availability and not having enough energy in the body. So I think it's a difficult one, because again, I go back to the societal messages, so everybody feels like they need to pull back, but then the low energy availability is causing so many wider effects that you might not realize for quite some time.
Yeah. Yeah, I guess just to add kind of from a reproductive standpoint and what we tend to see, we don't see a huge deal of people coming in with this, I guess. Or we do, or it's usually a previous diagnosis and then they want to come to us just to see what their fertility is doing. So often they'll be checking in on their cycling hormones and their AMH, the anti-Müllerian hormone. But if we do pick it up, it's generally due to the cycling hormone. So, and we know, like you were saying, with the low energy availability, often the hormones just they're not functioning as what they should be doing. So your follicle stimulating hormone, which is the hormone that matures the follicles at the start of your cycle, that's not working appropriately. So then your luteinizing hormone, so estrogen, like you were mentioning, estrogen's not working appropriately and that's not rising, and then it's not able to trigger luteinizing hormone, which triggers ovulation. So ovulation isn't occurring, which is where we see a problem in terms of reproductive system shutting down, but also it's estrogen and progesterone, two other important hormones that are involved in thickening the lining of our endometrium as well. So if they're not doing that, then if there is an embryo, then it's going to struggle to implant because the environment is not great. And then thinking from a nutrient perspective as well, what can happen as well, like you mentioned, if you're not getting enough nutrients in because your body's not able to efficiently absorb those, then that's going to have a negative impact in terms of carrying a pregnancy as well, or being able to get pregnant in the first place, because getting pregnant is such a nutrient dense thing that occurs. So we need to make sure that, especially just thinking about iron and things like that, and if we've got a low BMI and especially thinking sort of in fertility, say under 19, I know lots of the research is kind of around 18.5, but we say under 19, that's where we might run into problems as well. And quite often people with a BMI under 19 have maybe anemic as well. So just thinking about that population of people as well. So that's kind of from a fertility standpoint.
And actually what I've read, and maybe, I mean, you're maybe a bit more up to date, but what I've read is that although I'm not a massive fan of BMI, like most of us, but actually it does appear to be quite accurate when it comes to hormonal health, particularly. And actually a lot of women, and I find this in clinic, and it's what I've seen observationally as well, that the majority of women I work with generally need to have a BMI of around between 20 and 21 for their fertility, especially once they've lost it and then they're kind of trying to restart it. And it's not just the BMI, it's also the body fat percentage as well. And I know like there is a study that kind of indicates that, particularly again, once you've lost it, it's like the minimum amount of body fat required is 21%. But that doesn't mean that if you hit 21%, you're going to suddenly have a menstrual cycle, because again, it goes back to genetics, right? So if you're somebody that comes from a genetic background where you do just naturally have a higher body fat percentage, and that's not saying that you're unhealthy, that's just how your body is, then that will mean that you might need to actually have a body fat percentage of 24 or 25 before your menstrual cycle kicks back in. And I think it's really important to highlight that, because again, like I said, so many women I work with try and keep their bodies in these tiny little kind of containers almost, because that's what they perceive as acceptable. And yet we're all so different, and it's important to understand that, you know, we have to work with what we have been genetically and physiologically given, and that does mean that we come in different shapes and sizes.
Yeah, and I guess in terms of recovery as well, thinking about like going back to BMI again, but you can't just, you know, think about fertility. You can't just go and have fertility treatment if you are struggling and you haven't got a period. You do need to work on, you know, looking at why this is happening, and rather than just saying, right, I'm just going to go and have fertility treatment, ovulation or induction, that can potentially come later down the line, but you need to, you know, work on nutrition, good nutrition and rest and recovery before kind of jumping straight to thinking about treatment in that respect. Did you want me to go back to that one?
Either's fine, to be honest, because they're all pretty much the same. So I'm going to talk a little bit about REDS, just because we sort of mentioned it at the beginning. REDS, as I said, is relative energy deficiency in sport, but basically it's relative energy deficiency. I don't know why we have the sport bit, because it can affect anyone, if I'm brutally honest. And it's like I said, it's a multi-system problem. So REDS itself is like a combination of different symptoms. So often, like when I'm working with someone with REDS in clinic, it may well include, and most likely does include, some sort of downregulation of hormonal health, both in men and in women. There will be a higher risk of sort of connective tissue and bone injuries. Often by the time they come and see me, they've often had 1 or 2 stress fractures. So that's a pretty good indicator they've been in REDS for quite a while. Things I'm seeing quite a lot of recently is a lot of autoimmune type presentations as well. So there's a virus known as EBV, which is Epstein-Barr virus, and that seems to be very closely linked with REDS. So it seems to be related to more under recovery rather than the kind of low energy availability. So that's something we're seeing quite a bit. Like I said, we've seen some individuals with severe cardiac issues, you know, those troponin levels that you often see in individuals who have got myocarditis or having a heart attack. We're seeing them in athletes because of their body basically being in this highly stressed out state. So REDS is multi-system, because I think sometimes people get really confused between all the terminology. There's REDS, there's hypothalamic amenorrhea, and there's low energy availability. So low energy availability underpins REDS. It's often the main pillar of REDS, but REDS is also affected by under recovery and general stress going on in the body as well. And hypothalamic amenorrhea is the loss of your menstrual cycle. Usually we say 3 consecutive months of not having a menstrual cycle. I think that's the American kind of definition, and the English definition is 6 months, but I tend to use the American definition because I just think 3 months is long enough without having a menstrual cycle, because we know it starts to have a negative effect on your body within 3 months. So hypothalamic amenorrhea is often a symptom associated with REDS, and low energy availability can underpin REDS, but REDS is a condition. I hope that makes a bit more sense so that people can understand it. And REDS can be unintentional or intentional. So unintentional is fundamentally an individual just doesn't appreciate the amount of fuel and energy and rest they need in order to be able to manage all those different aspects of their life, both their training and their life. These individuals are quite easy to work with, in the sense of you can provide them with kind of advice around nutrition and advice around modification of training for a short period of time. And because there's no psychological involvement, they tend to actually take on your advice, and within a short period of time, they're generally back on track. Now, if they've had REDS for quite a while, it might still take time for their body to get fully back to normal, but they do tend to get back to normal without really any problems. And then where it gets more complicated is that we have this, as you can see, this like continuum. We have like intentional REDS, which will always have some sort of association of disordered eating or a full-blown eating disorder or some sort of exercise dependency. So there's a complex psychological involvement fundamentally going on. There's often a conscious decision to train too much, not rest enough, conscious decision to restrict your energy intake or remove a food. So this is more complicated. It's definitely the area I work in more.
I was gonna ask.
And I think it's because I know we're not here to do a webinar on eating disorders, so I'll keep it quite kind of brief, but I think it's important to remember that an eating disorder, dysfunctional behaviors around food and exercise, fundamentally, these are protective mechanisms. When I say that, they're not protective in the real sense, but they feel like protective mechanisms. They are ways of avoiding difficult emotions that individual is experiencing. So it's not conscious, but often those of us that get affected by eating disorders or disordered eating have a deep-rooted sense of there's something wrong with me. Or I'm falling short in some way, that kind of sense of there's something going on. And so these individuals want to feel okay, and they go in search of kind of what we call false refuges. And false refuges are like fixating on your body, fixating on food, fixating on exercise, because these temporarily give you reprieve from that really difficult psychological kind of chaos and noise that's going on internally. But it's a temporary reprieve, and so then it becomes something that's almost addictive. And the more you do it, the more ingrained it becomes. So we know eating disorders are complex mental illnesses. So I'm not going to sort of discuss those in detail, but I just want to help people to understand that it can be very difficult sometimes working with these individuals, because you're kind of trying to physically help them recover and repair, but you're also asking them to do the one thing that they've been using to feel safe. So it's a longer process, takes a lot of time, and I wouldn't say that it's a standard practice that most dietitians do, but
it's definitely an area of expertise for somebody to see someone like you as well. It's a very complex area.
And I think it's important to highlight that, because I think a lot of there are a lot of eating disorder dietitians, there are a lot of nutritionists working in eating disorders, and I'm not saying they're not helpful, because I think they are, but I think it's understanding that often you need that behavioral support as well. Now, you can obviously work with a psychologist and work with a nutrition practitioner, and I often work with many psychologists, and I often work also with a lot of psychiatrists as well. But I've done a lot of additional training in this area in order to be able to help people in that moment too. But if when it gets to a point where they start talking about complex traumas, then obviously it's time to refer and signpost to somebody else who can hold them and support them in that.
Yeah, thanks, Renee. I'm mindful that we're approaching the quarter past, so we might have some questions soon. So, getting to the common mistakes and how people can end up in low energy availability. I guess we've discussed it a little bit, but then we'll get on to treatment.
Yeah, I think you said we've discussed it really. It's like insufficient fueling is the most common one, whether that's intentional or unintentional, insufficient recovery. Like lots of people don't realize that rest is really important. And again, we've become part of this era that feels like you're almost like it's wrong to sit down. Like it feels like you need to be go, go, go the whole time. Yeah. Definitely fixating on a weight over performance is one I see time and time and time again in clinic. And that, yeah, again, like the over competing and over training is also problematic. And then it's very easy to cherry pick evidence, right? Because we can follow people who are basically validating what we believe on social media. And so we convince ourselves that it's okay, we can carry on with these behaviors. And then there's that kind of like developing limiting beliefs. And these are just beliefs that kind of limit your potential, but they keep you stuck because they're so strong, like the belief, like even if it's like I must walk 10,000 steps a day.
I was gonna say that one. Everyone says that. Oh, it's always 10,000 steps. I think there was a marketing campaign, right? And they obviously did really well because everybody is terrified that if they don't get their 10,000 steps in, something bad is going to happen. But
it's just been disproven. There's a study that came out last week, and it's just been disproven. You don't need to walk 10,000 steps a day. Like you said, it's a marketing ploy. And it's actually more about just being generally a bit more active. And actually, there seems to be benefits from around 6,000 steps a day. Yeah, so anyway, more on that as that emerges. But yeah.
I'm looking forward to seeing that. Sorry, go on, Reen.
No, I think this again is quite self-explanatory in that often individuals that do fall kind of, I guess, victim to dysfunctional behaviors, it's usually because we do tend to be certain types of individuals. Like it's that kind of very type A personality. And I'm not saying everybody who's that personality is going to definitely end up with dysfunctional behaviors. I'm not saying that at all, but often it's that personality type. And if you put them in the right psychosocial space, perfect storm that then can create this dysfunctional thinking, and then that affects your behaviors. So I think it's just being aware of that. I think this one we don't need to go through, but I wanted to have it here because I feel like it's one of those where these are questions I would ask someone. And I think basically if you say yes to more than 2 or 3 of these, then there's potentially something going on, and it's definitely worth reaching out and getting some help.
Yeah, I think, just to touch on, because you mentioned about males there, and you said about males as well, being able to, males do experience REDs as well, which is often maybe not realized as well. And just in terms of male fertility as well, because we've spoken about female fertility, it can affect male fertility as well in terms of sperm parameters. So actually, not exercising, so not doing any movement at all, and for both male and female fertility is not ideal, but also kind of going the other way and being excessive as well. For men, it can affect testosterone, and that can have an impact on sperm parameters as well. So important to note as well that it can affect both men and women, or males and females.
We've kind of discussed this. I was just basically saying with the female body that, we have to kind of respect our bodies and what they are and where they fit in the of kind of normal.
Yeah, and I think this is probably a question that will come up as well, because I often get asked this as well. And just obviously whilst we're talking about exercise and fertility, is what exercise should we be doing? And it's difficult because in lots of fertility clinics, different doctors will recommend their patients either like do very minimal exercise, or some will say like just continue with what you're doing. Some people recommend doing more, so it can be really hard, and obviously we wouldn't want to go against what somebody's fertility doctor had told them as well. But in terms of I'm just thinking about the evidence specifically in female body, we know there is some evidence suggesting that over 60 minutes per day of vigorous exercise can cause anovulation, so can affect ovulation and for you to not ovulate or release an egg. So just thinking like specifically about the type and duration is important. So but again, like I was saying a minute ago, also lack of exercise is not ideal. We want to be doing some sort of exercise. So what is the optimum? I mean, when it comes to the research, there isn't loads specifically looking at moderate exercise levels and fertility. However, it looks as though the public health recommendations of the 150 minutes per week of moderate exercise plus the 2 strength training activities per week seem to be optimum when it comes to fertility. And that's both with natural conception and with IVF and fertility treatment outcomes. So yeah, I guess it's just like trying to find the balance. And yeah, like we were saying, the reason why we don't want to be doing too much within one day or one training session is that it can have that what we've seen in that research is that can have a knock-on effect in terms of ovulation. So yeah, thinking of moderate exercise, it's things like actually like mowing the lawn can be classed as a moderate exercise, and just things like jogging, swimming, dancing, those are kind of moderate. And then when we think of more vigorous, it's like running or you know, going on a huge fast bike ride. So because quite often I think people get confused as to what exactly moderate and vigorous is as well. Yeah, so for diagnosing REDS then.
Yeah, so when we're diagnosing RED, we do have to diagnose by exclusion. So like I said, often people will come into clinic and they will present with injuries. They may present with amenorrhea and various other things. But obviously amenorrhea can also be caused by a number of other medical and lifestyle factors. So we do kind of a load of tests. We look at all the hormonal health, but we also very much look at thyroid health, because the T3 and the T4 give us quite a big indicator of energy availability and what's going on. But also looking at things like immune markers and stress markers. So again, if prolactin is super high, that can mean a number of different things. So obviously, if you've got a breastfeeding mom and prolactin's high, it's probably because they're breastfeeding.
Yeah.
But if you haven't got a breastfeeding mom and prolactin is high, but less than 1,000, then that would indicate there's a lot of physical stress going on in the body. So there's a lot of exercise stress happening, and that, especially if you're pregnant, you want to see that come back down fundamentally. Sometimes, and we have had this, is that you get very, very high prolactin markers. So, you know, over 1,000 into the 2,000, that's a medical diagnosis, and that needs to be then seen by a specialist, because that would potentially be suggesting there's something like prolactinemia going on. So that definitely needs to be investigated. So there, like I said, there's quite a range of tests that we do. We obviously do a complete assessment of nutritional intake and training to see the matching. We'll do like a weight and body composition history, because I think, again, as we've talked about, it's really important to understand where somebody was when their menstruation first started, even as a teenager, because it gives a pretty good indicator of kind of what their body roughly will need to be in order to get back. And I'm not saying that you're going to be the same as you were a teenager, but as in you get an idea that, you know, if you were a super lean teenager and you got your menstrual cycle at 14, then chances are you're probably going to be a lean individual that's going to get your menstrual cycle back with all the right kind of support and help in place. Yeah. Whereas if you were someone that was maybe, you know, kind of did have a little bit more body fat as a teenager, and then you got your menstrual cycle, chances are you might need to have a similar amount of body fat in order to get your menstrual cycle to start again, because it is very specific to you. Like, that's the thing about menstrual health, right? It's very individual, it's very specific. So we do we do look at that as well. And then also we're also looking at individuals' relationship with both food and body and exercise, because those are, as we've heard, quite complex at times.
It's interesting what you're saying about the prolactin, actually, because we test prolactin at Hertility, and often if we get someone who's got a high prolactin but everything else kind of seems like it's okay, there's not really a disruption to any of the other cycling hormones, thyroid hormones are all in order, then quite often if you dig deep, then sometimes you can figure out that they maybe did some training or exercise on that morning, and then so it shot their prolactin up, and that's why we get them to take the test fasted, is just because of that prolactin, because it is such a sensitive hormone, isn't it? And it's important to, you know, look at the other hormones as well. And yeah, kind of like you're saying, even if you've had like a you know, obviously if you're pregnant, but if you've had a recent breast examination, for example, it can cause prolactin to be high as well, which is why it's good to look at the whole picture and or retest as well if you have got a high result. So very cute picture. Is that your dog?
That's one of my dogs, yes.
Thank you.
Yeah, so I guess rest recovery, I mean, I think it's just remembering that training in itself is quite expensive. So rest recovery is going to involve energy restoration. It's going to involve probably some sort of modification of training. That's not to say it will be complete stop, unless somebody is clinically significantly at risk. And then of course I will absolutely stop. But generally speaking, it's just a bit of modification. And it does involve like challenging people's beliefs to a certain degree and helping them through change, which again is a big part of it. So it's not a simple quick fix. It's definitely not linear, and it's definitely not fast. There's studies suggesting that it can take a minimum of 18 months to fully recover from RED-S, to get to a point where your body's kind of like, okay, it's working, it's adapting. So you might get your menstruation back within 6 months, but you've still got another 12 months before everything is repaired and recovered and ready to kind of start, especially adapting from training. I think that's what people find the hardest to take on board, is that, yeah, you might get your period back quite quickly, but there's been more damage done internally than you've realized, and there's like been a lot more. It's almost like a metabolic injury, and that metabolic keep on improving and getting better before it can then really start to get to where your body's naturally going to end up.
So it can be quite a long recovery process, even, like you said, after your menstrual cycle's returned, there's still kind of everything else that we need to make sure is back up to what it was before.
Yeah, exactly. So I think we've kind of covered that just in terms of sort of the food groups that we need, which is basically we do need a lot of carbohydrate. And, you know, as we've talked about sort of throughout the session, you know, the carbohydrate, the dairy and soya is really key for bone health. But I think it's important to highlight that just eating a lot of dairy or soya, if you don't have a menstrual cycle, it's still not going to really support your bone health. That you need that estrogen. Estrogen is probably the key component of healthy bone health. So so it's really key to, it's really important to highlight that. Obviously, protein, B vitamins, these are all of these things are like really necessary for our fertility fundamentally, and for our hormonal health, right? Like we need to replace the iron we lose, so that women who are having menstrual cycles, if you're having very heavy menstrual cycles, you will need to keep an eye on your iron intake, particularly as well if you are doing more endurance training, because we know that it can lead to, you know, kind of more breakdown of red blood cells. So you could be having quite high losses overall. And essential fatty acids are really key in terms of kind of helping with recovery and like preventing fatigue, but also kind of reducing that overall inflammation. So it's kind of quite a few things to think about. Nutrition is not just energy. There's a lot of other interactions as well.
It's definitely an overlap there, like you're saying, kind of with fertility and then like recovery nutrition, like you mentioned about the antioxidants and stuff, just dampening down that inflammatory effect. And we know that getting your berries in and your omega-3 fatty acids from oily fish are really important. So following a Mediterranean style diet is what we say for fertility. And people hear me going on all the time about antioxidants for fertility, are probably bored of it now, but so important. Training modifications, and we've kind of touched on that. I'm just Yeah, we've hit the hour, Rini. So yeah, I guess just to finish off, then we'll take some questions now if there's any in the chat. But yeah, hopefully we've reiterated now that it's not normal to not have a period. And you know, at Hertility, we you know, our mission is to empower women. We all openly talk about our menstrual cycles, and that's kind of our mission as well. Is and you know, to get people to track their menstrual cycles as well. You know, we encourage that, but also obviously tracking your hormone health. Anything else you want to say, really, before we go to questions?
Oh, I think we've given them a very whistle-stop tour, but there's been hopefully lots of good information there that they're happy with.
Does anybody have any questions? There might not actually be any, which would take us perfectly up until the time, which means if there aren't any, then we've done a really good job. Oh, we've got somebody raised a hand.
Box, I think. There's quite a lot in the question box.
Oh, I can't see that.
There's 23. So I'm not sure we'll get time to see all of them.
Okay. Can you see them, Rini?
Can see them, yes. Do you want me to read? I'll read them out and you tell me how many we can do, but we'll start and we'll just go. So I've been taking a preconception supplement for about 6 months now because we had planned to start trying to get pregnant 3 months ago, but there has been some logistical issues to straighten out before we could start trying. Is there a danger to keep taking supplements long term? We plan to start trying when I get back from my work trip in a couple of weeks.
Yeah, I guess it sounds like you're probably just taking a preconception supplement that's got vitamin D, folic acid in, and tends to have lots of vitamins that you would get in like a multivitamin, but it tends just to not have vitamin A, just because we want to avoid that for pregnancy. So there's not really any harm. You don't the only ones that are recommended anyway are by the government is to have folic acid and vitamin D. So you don't necessarily need to take them, but those are the ones, you know, you've kind of started taking them at a perfect amount of time. We would always kind of say to optimize your fertility 6 months, you know, in an ideal world, if not kind of 3 to 4 months prior to conception. So no harm in taking them beforehand. We want to take them because actually things like folic acid are involved in egg quality and ovulation as well. So you just have to be mindful over time with if you were taking high doses of folic acid over a very long period of time, but we don't want to not take it. So it's definitely an important one to continue with. So yeah, keep going with it. And you know, if you were a vegetarian or anything like that, then you might consider even potentially looking at other supplements there. So just thinking about iodine if you're not taking those, but you also might have that in your preconception supplement anyway. But yeah, no harm if it's just the preconception one.
Okay, so what would you suggest to someone who doesn't wake up hungry and can go until 11, 12 until eating? I would personally say it probably isn't I mean, especially if you're going to do, if you're doing a workout, I definitely wouldn't recommend it at all. But equally, I think sometimes when people get into the habit of not eating, it means that actually it's more that they've overridden their hunger cues, and so that their bodies kind of learn not to have hunger cues at that stage. I do think there's real benefit in trying to eat regularly throughout the day. And we also know that there's really good science about actually having breakfast means that you have better glycemic control later on in the day. So you're less likely to kind of pick up on, you know, kind of non-nutrient dense snacks, which I think we all get that sort of 4 p.m. slump. So I think I would suggest that it's definitely worth trying to take something, even if it's like, you know, a piece of fruit or a yogurt pot or even just a glass of juice to start with. I definitely try and recommend having something before 11, 12 o'clock personally.
Yeah. Sorry, I don't know why I can't see the questions.
Okay. When women lose their periods, is this because of low body fat, or can a woman be in a normal body fat range and lose it? Are there any other factors? I mean, hopefully we've covered that, but fundamentally, it's not just about body fat, it's about being in low energy availability. So I think what I find is if women have lost a lot of weight rapidly, even if they've gone, say, from overweight just into the top end of like normal weight range, if we're looking at ranges, so even then we have a lot of women that can lose their menstrual cycle quite quickly. And it also depends on what your nutritional intake looks like too. So if you've done quite a like quite a extreme weight loss, like something like intermittent fasting or avoiding carbohydrate, like all of these things are going to basically have an effect on your menstrual cycle. So I'd say it's not the easiest question to answer in full without knowing the full picture, but I would definitely say it's not just about body fat.
Yeah, just thinking about things like stress and stuff as well. Stress plays a huge role, doesn't it?
Yeah,
Lack of
totally.
sleep and
Yeah. Can RED-S also cause your period to be later than usual? Yes, it can. So RED-S, as we said, it can affect your overall hormonal cycle. So what women might find is that actually they see changes to their cycle first before they lose it completely. So you might notice that you might get shorter cycles, so like 21, 22 days, which would be what Emily was talking about, that there's anovatory cycles where you're not ovulating. So basically the body's like, there's not enough energy here to ovulate, or your exercise intensity is impacting your production of luteinizing hormone, which prevents that ovulation. Or you might get longer cycles, which means that maybe ovulation is being delayed for whatever reason. So any sort of change, I would say, is worth monitoring. And then, I wouldn't say if you just have one, I wouldn't say panic at that point. But I think if you like over 2 or 3 months, if you're starting to see there's a consistent change from your normal, that's when I would definitely be questioning. And I guess if someone's menstrual cycle changes like that, that would be a good time to maybe, kind of go to Hertility and do a blood test to check to see what's happening with your hormones and things. And that could be quite a useful guide and hopefully prevent it from getting any worse and you losing your period completely.
yeah. And just to say as well, quite often people don't know what's considered a regular or an irregular menstrual cycle as well. So we say anything less than 21 days or anything over 35 days is considered irregular. But also if it's kind of varying by, we naturally will have some variation month to month, but if you're noticing that it is changing kind of by more than 7 days each, every month, then you'd be looking into that. And for an actual period, a bleed, we say anything from 2 to 7 days is considered normal, but for most people we tend to bleed around 5 days, but anything between the 2 and 7 is normal. But yeah, lots of people I think get quite confused with that. But again, it just comes down to poor education in all of our schools.
Does a history of anorexia have an irreversible effect on your fertility, even if you're now at a healthy weight? The answer to that question is no, as in generally speaking, even if you've had anorexia and you have been a very, very low weight, yes, your hormonal health will have been down-regulated. But it's very, very rare cases where your fertility doesn't return. Very, very rare cases. So if you're a healthy weight, again, this would be a point, especially if you've been a healthy weight for some time, this would be where I would be looking at your hormonal health. I'd be looking at blood tests just to see what's going on. Because one thing I will say, and I've worked with a lot of people with who've had anorexia in their past, often people who've had anorexia in their past will get very hung up on a particular target weight that they have been assigned at some point, but that might have been assigned to you when you were a teenager and you're now a grown woman. And so that weight might not necessarily be the right weight for you. So I think we can think we're a healthy weight, but it might be that it's not quite the healthy weight for you, or potentially your nutrient timing is still off, or maybe you're still doing too much exercise, or perhaps the composition of your diet. There's so many reasons why your fertility may not have returned. And so I think that's where doing blood tests can be really helpful, because it can then give us a bit more insight into what's happening here, and then we can kind of guide you appropriately. There's lots of questions.
I mean, feel free to leave it there if you want to, Rini. We can, if anybody else has any other questions, then you can get back in touch with us at Hertility, and we can always answer those for you. Or equally, depending on kind of what speciality you need, you can book in with either of us, whether it's like, you know, we mentioned our specialities, whether it's Hertility or in Rini's clinic, depending on kind of what care you need. Any others you want to do before we go, or just
I'll do two more because these two are
all right, well,
quite useful, and I think then we've probably covered most.
yeah, we
So,
appreciate it. Thanks, Rini.
does having an obese BMI have an impact on fertility if you keep active and have regular cycles? I'm going to hand that one over to you.
Yeah, so so we do know that it can have an impact. So like we were saying about a low BMI earlier, we know that a higher BMI can have an impact in terms of the research. However, if you came to me and said, right, I'm gonna go and lose a load of weight in order to be able to have a baby, we, in terms of like, or to be able to access fertility treatment, in terms of what the research says in live birth weights, there isn't any there isn't any research to suggest that losing weight will increase your chances of having a baby whilst undergoing fertility treatment. And also you have to think that if you are going on, so quite often, so a BMI cutoff in the NHS is a lot tighter than what it is in the private fertility clinics. So you have a bit more leeway in a private clinic. But if you are sent away in the NHS and told to go and lose weight within a short time frame, and especially thinking about kind of your age as well, if you're kind of eligible for treatment and therefore, you know, trying to do it quickly, you have to consider that going on a restrictive diet is, you know, we've kind of, hopefully you'll realize from what we've discussed today, not ideal in terms of your hormonal health, and it's likely that you're going to be cutting out lots of nutrients that you require for fertility. So I guess it's what was the question specifically for?
So the obese BMI for fertility, and yeah, if you keep active and have regular cycles.
If you keep active, yeah, again, so if you're having regular cycles, it's a good sign that you're ovulating. So it doesn't mean to say that you won't be able to get pregnant. So yeah, and like I was mentioning earlier, in terms of keeping active, the optimum is kind of that moderate 150 minutes per week plus the 2 strength training exercise. And it's better than staying inactive or going over that kind of vigorous exercise or that excessive threshold. Yeah, I hope that answered that in a roundabout way.
I'll do this last one, and then yeah, everything else will need to be emailed in or something, I think. But it says, if you are a personal trainer and your client says they have HA, what is your advice? Stop training or adjust strength sessions to include more breath work, mobility, lighter loads, etc. I think the answer is it depends, because it does depend on what else is going on for that individual. If that individual is also low in weight, then it might be that actually you have to stop everything, depending on how low weight they are, what their BMI is, what the potential clinical risks are, and also how long they've been underweight, because we know that obviously the longer you are underweight, the more potentially you're affecting heart muscle, and obviously that can make it weaker. And so we've got to be very careful. I think personal trainers have to be very, very careful about that. If, however, the individual is a healthy weight, they've had HA for a short period of time, then yes, I generally tend to recommend stopping all cardio-based training, because we know that tends to have a much higher sort of impact from a stress point of view and stress on the body. Working mainly on strength, but again, even strength, doing more kind of, you know, the sort of slower aspects of strength. So not CrossFit or high rocks or any of the crazy new trends that are coming about, but more kind of compound movements, but with lots of rest in between as well. And yeah, mobility is great. Things like yoga are also good. Pilates are really good. That kind of work will be better than like, you know, like a big heavy gym session.
Thanks, Renee. Well, thank you so much, because we ran quite some time over, so really, really appreciate it. Yeah, we really appreciate your expertise. Thank you everyone for joining. As I said, it's been recorded, so we will upload it to the YouTube channel, and likely send an email out to you to let you know that it's there. But yeah, thank you so much for joining us, Renee.
Thank you for having me. And yeah, thanks everybody for being there.